Hi, I'm Lucy Diaz. This is an interview I had with Dr. Tilak Dutta from Kite Research Institute. He has a PhD in mechanical engineering focusing on preventing back injuries in caregivers. In this video, we talked about lifts and why they're necessary. Enjoy!
So I'm Tilak Dutta. I'm a scientist at University Health Network, Toronto Rehab Institute. And my research in the past has looked at ways of preventing back injury, the needs of caregivers when they're lifting and moving people. And I also happen to have a son who has some disabilities and uses a wheelchair. He's only 4 now, but I suspect that soon the topic that we're getting at is going to become very important for him, for us to be able to get out and about, to be able to access the types of spaces that we want to with him.
Yeah, thank you. So if you could just give kind of like a brief example, like what is a hoist or a lift? Like what would be the definition of that?
Yeah, so I mean, the idea is that things that are heavy, we don't want to use our bodies to lift. You know, there's a limit to how much weight our bodies can lift safely if we're doing it over and over again. And so there's this group of medical devices called patient lifts. Some people call them hoists, some people call them patient lifts. And there's 2 broad types. There's one type that attaches to a track in the ceiling, and you can move this. It's essentially a motor that has a strap coming down from it that you get a controller that has arrows, an up arrow and a down arrow, and you press the up arrow and it lifts the strap up. It can lift a person that's in a sling. So you put a sheet around them that has loops on the corners of the sheet, and you bring those loops and attach it to the end of the strap. There's usually a bar that comes down from the strap, and at the end of those bars are hooks, and you take the loops on the sheet and you loop those over the ends of the bar, and you can lift people up without having to put any strain or stress on the caregiver at all, and the healthcare worker, or if it's a family member lifting and moving someone, all of the lifting force is provided by that device. So I mentioned there's one type is what we call a ceiling lift. The other type is called a floor lift. Some people call it a mobile lift, a mobile hoist, a Hoyer lift, lots of different names for these things. Though that type is actually the first type that was developed, and it has wheels that roll around on the floor. And it looks kind of like an engine hoist. It was actually, I think, designed based on what's used to lift engines out of cars. If you go to a mechanic shop, you'll see these hanging there with chains hanging from them. And the idea is, instead of a heavy engine, you're lifting a person with this. So either a ceiling lift or a floor lift. Nowadays, we all, in the field of lifting, people generally accept that the overhead lift or the ceiling lift type are much better and easier to use compared to the floor lift type. The ceiling lifts, what it allows is it doesn't take up any floor space, first of all. It doesn't need to, it gets stored right on the ceiling in the corner of the room or at the end of the track, wherever the track is. And it's much easier, once you've got the patient lifted up in this thing, it's much easier for them to get moved around wherever they need to go. Versus if you have the floor lift type, you have these handles that you have to push, and it's actually quite challenging. Some of our biomechanics studies, so that I participated in, have shown that the loads the amount that you have to push these lifts when you have a patient in there can cause injury in themselves. So you're not really solving, what we're trying to do with these lifts is reduce the risk of back injury for whoever's doing the lifting and moving. The challenge with the floor lift is we're introducing all these new activities that might also cause injuries. So it's better to get the ceiling lifts if possible.
Thank you. So if you could give, I didn't actually know about that it was originally based on an engine lift.
Yeah, that's what they look like. If you search engine hoist, look at how similar it looks to a Hoyer lift. You'll see that it's basically the same thing.
Yeah, that's cool. So if you could give kind of like a brief explanation about who would use a lift or a hoist.
Yeah, so I mean, really, anyone that's involved in lifting and moving people, you should think about using one of these. The and it really depends on how much support I'm going to call them a patient in this case, but it could be a family member, whoever needs to be moved, how much support they can provide, right? How much really leg strength do they have? Can they bear weight on their legs? And if they can bear some weight on their legs, then there's other ways of helping the person get up out of a bed or out of a chair. Let's say they're being transferred out of a bed into a chair, or out of a wheelchair onto a toilet, for instance, if that's something that has to happen. If they can take some of their body weight on their legs, then you might be able to get away without a lift. But if the person can't do that, then you probably need a lift to do it safely. And the cutoff, we usually talk about, there's some debate on how much weight is safe to lift, right? For anyone to lift in any job. In a factory, for instance, if you're lifting boxes, or if you're a construction worker, people talk about 50 pounds being the limit. But when it comes to people, lifting people is very different than lifting a box, right? A box, usually you can put like handles on it, and it can be easier to lift. If you have you can get a good grip on it, right? You can get your hands into something, or a suitcase, you've got a nice handle that you can grab. People don't have handles, so usually we talk about 35 pounds being the amount that you can safely lift if you have to lift and move someone. So if really, I would say, to answer your question, to summarize, is anyone that if the caregiver, right, the healthcare worker or the family member that's lifting the person, if they have to support more than 35 pounds, you probably should be using a lift.
Okay, thank you. Yeah, that's definitely way more than my sister weighs.
Yeah. Can I ask how much your sister weighs?
I'm not sure, but maybe 140.
Yeah.
So it's more. It's because my mom's already injured, my dad as well, from all the years that we've gone, not even knowing. I don't think they even knew that lifts kind of existed.
Yeah.
At that point. So is there a right or a wrong way to transfer someone?
Yeah, I mean, there's lots. There's lots of strategies and approaches that you have to be careful of, and it's so dependent on the person you're lifting and their specific abilities. But with the use of these lifts, there are techniques. People will tell you that there are safe ways. Some people believe that there are safe ways to lift someone manually, right, without the use of a lift. One person and two person strategies, but frankly, it's dangerous for both. If the person can't bear weight consistently or reliably, right? There's sometimes you have patients who can stand up for a little while, but they might collapse suddenly because of something related to their condition. A case like that, where that could happen, where someone has poor balance, for instance, and their balance might get thrown off, and suddenly whoever's there trying to transfer them has to suddenly take over all the weight, sort of catch someone. That's almost one of the most dangerous scenarios you can get yourself into. So, in this field, we talk about usually, picking this, even if the person can support some of their weight, it may still be important to use a lift to move them, so that you don't get yourself into one of these situations where the person is off balance and falling, where you have to catch them, and it's a real a really high chance of them getting hurt in that scenario.
Mm-hmm. So what are some consequences of not having lifts or hoists?
Yeah, I mean, so I think the obvious one is, well, there's two. I would say there's the risk of the healthcare worker or the family member who's moving them, of moving them, of them being injured over time. And, this is one of these things where, as you mentioned, it is something that happens over time. There's this thing we call cumulative. There's a cumulative effect here, which, like, damage that happens over time that our bodies aren't given a chance to heal. And if that occurs over a long period of time, it can cause injury. It can cause kind of degeneration of the tissues in our spine. The other side of it is the patient. Worst case scenario is they have a fall in the midst of a transfer. If there's not a lift, someone's trying to lift them. There's someone loses their balance, the person could fall, have a head injury. You can imagine all the different types of injuries that could come from someone falling if it's not a controlled lift. And the other side, I would say the other major consequence that maybe we don't think about enough is that people just stop going places and doing things because the risk is too great, right? People families like yourselves, I remember hearing your mom talk about this, where I think people become limited. We become limited in what we can, in the places we can go and the things we can do, having negative effects, not only for the person that might need a lift, but also for their family as well.
Yeah.
But I think you could speak to that better than I could, I'm sure.
Yeah, it's kind of, we don't really go places because of that. And, it's not great being stuck inside all the time.
Mm-hmm.
Yeah. So is there a requirement about space needed inside a room to safely transfer someone or to insert a ceiling lift?
Yeah, I think actually I would look to you guys, the Changing Places standard. My understanding is the UK has been very proactive in coming up with new standards for this need, right? Having specially designed bathrooms where there is a lift and an adult size change table available. And my understanding is that there are standards that are drafted around that, though I haven't been involved in putting them together, and I couldn't quote any of those requirements to you right now. But mm-hmm. I would say a great place to look would be what have other countries that are leading in this area. I think North America has been quite behind in this, and we often see that. We often see in accessibility, in the areas of accessibility, European countries seem to be leading in this area, and so I think that would be a good place to look.
Yes, thank you. So what would be needed in order to kind of get lifts to be kind of like, I don't know how to explain it. Let's say there is a Canada Day celebration, right? And you need a facility, a washroom with like full table and a lift. Like, what are some things that would be needed to like design something like that?
Yeah, thinking about it from the ground up, there's so many considerations. One solution, just to think about what happens around Canada Day, I always picture it's sort of a temporary kind of setup, right? So I think that's a slightly different scenario than something where you're designing a new building or a hospital or some kind of public building where you want to design this in. I would think something like a Canada Day thing where you have lots of people coming and you need to set up temporarily. I have seen trailers, like sort of like a porta potty, but it's bigger than that. It's a trailer that gets towed in that has a change table and a lift inside it that's accessible, that you can roll a wheelchair into, that's designed kind of designed to this Changing Places standard. I think I've seen a picture of it. So that was a really interesting picture to come across when I came across it, and I can try to dig that out and send it to you.
Yeah, thank you. So are there any, so I know you've done a lot of studies, so are there any documenting like what kind of injuries are caused by lifting without a lift, and are there any ways to kind of be safer when doing that if you have no other option?
Yeah. So, yeah. So, sorry, what was the first part of the question?
First part of the question was, are there any studies finding what specific injuries are caused by moving someone without a lift?
Yeah, I mean, it's hard to pin down specifics. Like as we get older, I think, spine, back injury, it's a very, it's a challenging area to comment about specifics because I think all of us as we get older, we tend to, our tissues break down, our tissues, there's almost, most people have something that looks out of place or looks like there's tissue damage. If you did for instance, if you did an MRI or a CAT scan of anyone, I would say over the age of like 30, you would probably find something that looks unusual in their spine, like something that looks like a bulging disc. Some people talk about something like that. So it's difficult to say what caused it. Back pain and back injuries are the leading cause of disability in the world. And if you look at over a general person's lifetime, like most people will experience back pain at some point. People that do a lot of lifting, that it seems like the research shows that it's even more likely that we're going to experience some kind of back pain over the course of our lives. But it's hard to say exactly what is the cause of it, or what causes what, because I think we probably engage in activities other than lifting people that is causing us to hurt ourselves a lot, right? Like we probably do a lot of things that it leads to tissue breakdown, and how much of it's preventable is unknown. I don't think we understand, whether just everyday activities that we do, how much sitting in a chair all day long, if you're sitting in front of a computer, how bad is that for our spine? We don't really understand all of these things that well. But yeah, so then, sorry, the second part of the question?
Are there any ways to avoid it if you have no other way to move a person?
Yeah, right. So so from what I can tell in this field, what you want to do here, maybe I can actually share a picture of what I'm talking about. You want to avoid spine flexion. Let me see if I can just quickly dig up a picture here to show you what I mean.
Yeah.
So if can I share my screen here?
Yeah, you can.
Okay, here we go. So let me just find part of this where we do. So actually here's the picture of what a lift. So this is a floor lift. This is what a ceiling lift looks like. The thing that the patient is in is called the sling. So you connect, you have to get the person onto the sling and then connect the sling to the lift. So it's either the floor lift or the ceiling lift. So the thing, if the one thing to focus on, I would say, if you're trying to avoid, if you have to do manual lifting activities, if you have to really beyond lifting activities, just in your day-to-day movements, what we want to do is avoid flexing the spine. Instead, we want to flex from the hips. So we want to stick our bums out and keep the lower part of our spine. This is called the lumbar region of the spine down here. We want to keep that as straight as possible. And by straight, there's actually a curve, a natural curve in your low back. You want to maintain that natural curve in your low back when you're lifting and moving things. And what that does is it keeps the disc. So you know how our spine is made up of this like stack of bones, right? The actual vertebrae, those are the physical bones that are in there, hard bones. And then in between the bones are these discs that are more flexible and malleable, right? And that's what allows us to bend and twist and so on, right? Those sections kind of move and tilt relative to each other. But when we flex the spine, like in the picture on the right, what happens is there's this, we call it the nucleus pulposus. In the middle of the disc, there's this gel that kind of starts to push its way through the back part of the disc. And that's what causes, over time, our discs to start to degenerate. These discs are made of layers of, we call it collagen, the different fibers that are wrapped around each other. And what can happen is this nucleus pulposus that's in the middle, this gel, can start to work its way through those layers of material that make up what's called the annulus fibrosus, the outside of these discs. And that happens because we're kind of, if we squish the disc like this, it pushes that nucleus pulposus, that gel, backwards, and it makes it, there's sort of this hydrostatic pressure that pushes it back. It's sort of like if you think about taking a watermelon seed in your fingers and you squeeze it, it will want to shoot out, right? It's like putting that kind of a force on the gel inside your disc if you flex your spine. So your goal should always be, whenever you're moving, to try to limit how much you're flexing your spine. You want to keep, see how he's sort of keeping, in this picture, we're keeping he's got his bum sticking out. You always think, stick your bum out, keep the lower part of the spine straight. And if you can do that, there's a lot of people who believe that that is one of the best things we can do to avoid having kind of this accumulation of tissue damage from happening. But other people disagree with that. But at least looking at it from a perspective of like, we have these tissues, we can, it's sort of like, does that for sure cause injury? We don't know. But it definitely is a way of reducing the local stress that those tissues experience. So, so that's definitely one thing to do. The other thing to do is to avoid twisting, especially when you're lifting something. So avoid twisting your spine. You should use your feet to move. If you need to turn over here and do something, rather than twisting your spine, you can turn your whole body, right? Imagine if I'm standing right now, right? I would take my feet and point them in the direction I want to go, rather than keep my feet pointing straight and turn my upper body. So I would say those are two things that you could do. A third one is to imagine that your spine is sort of like this, like I mentioned, it's like this stack. It's sort of this wobbly stack of bones and these discs in between, right? So what happens is you want to support that equally from all sides. So one thing you want to avoid doing is lifting, for instance, a lot of weight with one arm when there's nothing in your other arm. So it's always better to try to balance the load between your two arms so that you don't have any imbalance in how much load your body has to support it from kind of left to right. Does that do those three things kind of make sense to you?
Yeah, thank you.
Yeah.
So how much does the use of a lift, if there is a study for that, how much does the use of a lift reduce the number of injuries?
Yeah, there's been studies on that. I don't have the numbers offhand, but it's pretty dramatic. And we can dig out some actual numbers if you want. But in hospitals and nursing homes where overall where these types of lifts have been incorporated pretty broadly now, we have these things called no lift policies in hospitals and nursing homes. So they, over the past 20 years, I would say this has really shifted the number of back injuries and back pain that's experienced, and the loads on people's bodies by a lot. But I can dig out those numbers if you'd like.
Yeah, that would be great.
Mm-hmm.
Yeah, so that's all the questions I have, actually.
Okay. Yeah.
Thank
Great.
you so much.
You're very welcome. Yeah, I hope this is useful for you.
Yeah, thank you so much for meeting with me.
Good. Okay.
Moving a person without a lift is incredibly dangerous, which means that washrooms without a lift are dangerous. And thank you so much, Tilak, for meeting with me and doing this interview. I appreciated it extremely. And if you want more information, go to the description. We'll have links so you can learn more about this topic. Thanks for watching.